It's not a surprise to me that autopsy research is a little bit of a problem area. And for anyone who has been following me, I am consistently asking for more and more autopsies to be done around COVID. And people say autopsies are done all the time, but I am very specifically looking for autopsies in vaccinated cohorts because I keep arguing that based on the autoimmune paradigm related to spike protein, the disease pathology is likely to be different. The first full autopsy was done in 2023, but someone reminded me of an autopsy series that was done in Germany in late 2022. And as I looked back at it, I realized this is probably why they don't want to do more autopsies. Because for me, this is pretty significant information. And so, what I'll be taking you through today is a paper here in 2022. You can see it here, published online in November of 2022. Autopsy-based histopathological characterization of myocarditis after anti-SARS-CoV-2 vaccination. And this is the bit that I'm interested in. What exactly happens in the histology with regards to when someone has been vaccinated? Now, that's only one half of the puzzle, because the other piece that I want to know is what happens when they get reinfected, because I suspect, again, the pathology is very different from what happened in the early part of the pandemic. So these are the things that I think need to be studied, but nobody wants to look. And the more I look at what we already have, the more I think to myself, I'm not surprised, because if you're trying to protect a narrative, this is not going to help. Actually, this will destroy any narratives, because in fact, it will confirm what I think I've been highlighting for some time. So let's get into a few important details. And one of the things that I'm going to highlight to you is the cause of death in this cohort of people. And I'm just getting this to look a little bit a little bit bigger so that you can see this image here. Um, and this is what it looks like in terms of cause of death. You can see the age, the sex, pre-existing comorbidities. I have highlighted a number of them in red because these are all related to cardiac related symptoms. Now, I'll come back to that in a little bit. But the first phase of what we're talking about is around this question of myocarditis. And what really did the paper look at? So when you look at this here, they had standardized autopsies were performed on 25 per people who died unexpectedly and within 20 days after having been vaccinated. And they were specifically looking for myocarditis as the cause of death. I would have been different. I would have been looking for autoimmunity in relationship to their deaths. We'll come back to that in a bit. But what they then did is that they knew that the Federal State Registry in Germany contained autopsy, clinical, and pathological data, as well as tissue samples who died in the context of infection or after vaccination. They had about 54 that they were studying. It's important to note that's not everybody who had died, but this was a cohort that they could look at and try and see if they could see any patterns. When they looked at the heart here, what they found was that in the context of this 25 cases, they found consistent findings of epi or myocarditis. Carditis means heart inflammation, myo meaning the myocardium, the muscle, epi meaning the epicardium, another layer of the heart, and were found in 5 cases of the remaining 25 bodies found unexpectedly dead at home within 20 days following vaccination. That's an important number. 5 of the 25 cases had evidence of myocarditis. It's important to note that they don't necessarily then say that the myocarditis was the cause of death. For me, that is an absolute smoking gun, meaning that if somebody develops myocarditis within a few days of being vaccinated and then dies, if you can't tell me a specific other reason, in my view, it has to be the most plausible mechanism. But that's a different question because it depends on thresholds. Each person may have different thresholds. Continuing on here, as I said, all these people died within the first week following vaccination. The mean time, that means the average time of 2.5 days, mostly 2 days. So within 2 days of being vaccinated, these people died. The blood tests, ECGs, and everything were not available because they did not seek medical attention prior to death. Now, this is an important point because what it's indicating is that the person did not feel sick or did not feel sick enough that they thought that they needed to go into hospital or they needed to go and see their GP or their family doctor. This seems to have occurred relatively suddenly and unexpectedly. There was one case here that was partially seen. So, person one was found dead 12 hours after being vaccinated, and the witness described that he had rattling breath shortly before circulatory failure. That means he went into cardiac arrest. Somebody else, person two, felt a bit nauseous and was then found dead soon afterwards. Even though they were tried to be resuscitated, they weren't able to be. And the other people were found dead at home without available information. So, meaning that most likely they went to bed, they didn't wake up the next morning, and they were found in bed in the meantime of 2.5 days after the COVID vaccination, the mRNA in this case. Now, these are very relevant details because when it comes to people dying, there's a difference when somebody gets sick. But when it comes to someone dying suddenly, if it's not a massive bleed in their brain or if they haven't hemorrhaged out somewhere, the two big things that can occur, and there's electrolyte disturbances as well, but they tend to cause a cardiac or respiratory arrest. And usually it's the heart that just stops beating or beats inadequately, which then causes the output from the heart to drop suddenly. The person collapses, and if that output doesn't come back, that person would die. The other thing that can do that is a massive clot going to the lungs, blocking the blood flow. So, therefore, the heart can't pump any blood through. Again, the person will suddenly die. So, there are not a lot of conditions that will cause that kind of pattern. Sometimes, something like a seizure, if somebody has status epilepticus, they were in bed and they just continued to seize and they didn't stop, it could cause them to die. But again, they would usually have a history of epilepsy or something in the background. These people didn't seem to have anything, and this was a little bit of a surprise. So it leads us into an important point about what exactly they were looking for when they were doing this study. So they were looking for myocarditis because at that time there was a lot of attention on it, and the people needed to be reassured that this was not such a major issue. And so, of the 5 cases that they found with myocarditis, you can see in case one, this was a person who had rattling breath before. He had some underlying vessel disease. Um, and when they looked at his autopsy, there was nothing else significant here. And there was some congestion in his lung with alveolar edema. Similarly, here as well, in this person who had nausea, there was some congestion. So, what that suggests is a degree of relatively acute heart failure prior to the sudden collapse, because it takes some pressure to cause the fluid to back up in the lungs so that they get congested. And you can see other things. Somebody had COPD. So a lot of these people already had underlying arterial disease. And it's an important point that it's not that everybody is suddenly randomly at risk. Usually there is some degree of a predisposition. And in these people, they did have underlying vascular disease, then they're vaccinated, and then they have a sudden death. Now, what's interesting is that this cohort of patients is in the group that I would call the high risk. And in the high risk context, they would be at risk for severe COVID. And so there is a balance between the risk of dying from severe COVID versus the risk of getting a vaccine. On the balance, they probably got the vaccine, but some people were unlucky. And so it's not necessarily a criticism of what happened. It's more to do with what is the mechanism, why, and what exactly happens. And this is what leads us into the question with regards to the myocarditis. Okay, now follow along here. Now, this is a complex topic. I don't have the time to put it all together now. I actually thought of doing another one of a full webinar to explain all of the different things, but I genuinely don't know if that many people would be interested, because it takes a lot of time to put all the slides together and to do all the research. And I only want to do it if people really want to see it. So if you do, please let me know, and I will contemplate whether or not I'll put that together. So one of the most important points with regards to the autopsies here is this finding. In addition, FOXP3 positive regulatory cells and CD21 positive follicular dendritic cells were not detected within the cardiac infiltrates. Okay? I want you to remember this. FOXP3. That is actually the critical piece of information. They did find that there were focal concentrations of CD4 positive lymphocytes, and it would have looked something like this, where you have these patches of concentrated lymphocytes together, and they didn't have regulatory cells in them. And all of this inflammatory process can lead to some scarring. And this scarring is what can then cause some of the problems. Now, important to note that within 2.5 days, my opinion is that this mechanism would not have appeared. I think that this represents the fact that this was already present, probably from the first vaccine, and then when they had the second or third dose, this then becomes reactivated. And that's my thought as to why I think that was happening. And so you can see when we look at another histopathological slide, you can see this concentration of immune cells in the brown, and they are attacking something. And this is what then causes the focal damage, like tiny bits of microscarring in the heart, which then makes the heart much more prone to irregular rhythms. I've put together a diagram to slightly explain what it is that I think is happening here. And this is why I think I'd have to do a more detailed presentation in order to explain exactly what this is about. So here is what I call the myocardial cell. This is just one muscle cell. They're all connected, which is why you have these almost arms and legs, and they're connected to another cell. And it's an interesting thing that happens is that if the lipid nanoparticle that gets taken up in this muscle cell, it will then produce spike protein on the surface. And a very unusual thing happens. I was fascinated by it, is that when it does that, in some situations, instead of this cell being destroyed, it becomes protected by PDL1. And you find then that this cell is protected from immune attack. It's almost as if I like to get an analogy. It's almost as if the police are coming to break in and they have a warrant, or they don't have a warrant, and the person knows that, and so therefore they can't come in. And so all the police are gathered outside the house. They can't get in. They're getting annoyed. They start to kick down some other doors. And this then is what happens, because when you look carefully at the image here, you will realize that this cell is protected, but there is still inflammation happening outside this protected zone. The regulatory cells are pushed out to the side. They are not allowed in. These cells here just want to fight, and they will damage the cells that are present. And in my mind, this is what it would look like. And you would see these damaged cells surrounding this protected cell. And this is what causes the focal inflammatory process. Very, very interesting stuff. And it would explain why we see these unusual patterns. And therefore, when that focus happens, it can then trigger electrical signals that damage, and then that can cause unusual arrhythmias. The final point that I want to make is about the cause of death. So I did a little bit of a examination of thought and reflected on this a while ago. So just remember, this is my opinion, not that of the authors. And this is just me extrapolating clinical knowledge to try and make sense of what I'm seeing here. And when I looked at these cases, I then highlighted in pink all of the cases that were related to heart failure, heart failure, heart failure, heart failure, heart failure, myocardial infarction, heart failure, myocardial infarction, ruptured aortic aneurysm, because I know there's aortic inflammation. This fits. Right heart failure, myocardial infarction. All of these cases were deaths within 20 days of being vaccinated, and these were all heart-related stuff. Now, the other one that I wanted to highlight is the drug abuse, intoxication. There are a number of intoxication cases here, and this as well stands out to me because depending on which drug they were using, even if it was alcohol, if you do have some degree of microscarring, it can lower the threshold for electrical abnormalities. So intoxication may have been a contributory factor, but the combination could as well have been relevant. But that's just a possibility. The main point that I have taken away from this is that one, the concern I have about autoimmune responses with regards to spike protein is clearly confirmed in this data, because you don't get this kind of pattern where you have immune cells zoned in on particular areas of an organ if this is not some kind of immune dysregulation. And so the point is that we see these patterns more often with the heart, because you will get symptoms or someone will have a heart attack or something. But based on my extrapolation of the spike protein dropping anywhere, this kind of pattern could be happening scattered throughout the body: lungs, liver, kidneys, blood vessels. And so then when you have that kind of situation, this is where the risk exists on further re-exposure to spike protein, whatever the source. And that's been my concern from the start. I believe that not enough has been done to study this carefully, to look at patterns that are occurring around the pandemic, and to explain why deaths remain elevated above the pre-pandemic period, even after so many people have died. Part of it is that COVID is making people sick, but it's not just COVID. There seems to be an elephant in the room that needs to be addressed. We still have a lot of work to do, but as I said, autopsy research is the gold standard. because it tells us in a way that nothing else can the trajectory of disease, what is happening, and critically, what is likely to happen in the future. If you are interested in a presentation in more detail on this, please let me know, and I will try and put it together and host it at some point. It is all very fascinating, and there's still so much to learn. Have a great evening.
A hero, an immune adventure, Humming Heroes, your lyrical guide to the body's defenders. Now on Amazon. Check the links below.